Hello guys, today we will be discussing about the acetaminophen. In North America, it is most commonly available by the name of Tylenol, but it is also available over the counter by the name of acetaminophen as well. It comes in various strengths. It comes as 500 milligram tablet or uh, caplet or like a capsule or whatever, or also it comes as 325 milligram tablets as well. Well, for the pediatric patients, for the children, it comes in syrup as well as in drops as well. Acetaminophen is an analgesic as well as it is an antipyretic. Well, these two properties, being an analgesic and being an antipyretic of acetaminophen, they are comparable to aspirin, means it has the same efficiency, same efficacy. Acetaminophen, which is N-acetyl para-aminophenol, it is the only aniline derivative which is currently in clinical use. It is the drug of choice when aspirin cannot be used because of gastric problems or other contraindications, or person is allergic to aspirin, we can give acetaminophen. The drug's mechanism of action also seems to stem from the inhibition of the prostaglandin synthesis, means it has a different mechanism of action but seems that it also inhibits the synthesis of prostaglandins. Although there may be some differences in the spectrum of those COX enzymes, cyclooxygenase enzymes, which are being inhibited. It has been suggested that acetaminophen may be more active than aspirin as the inhibitor of CNS COX, means it is a better antipyretic and less active in the periphery. Although more recent reports of newly characterized CNS isoform in humans, which we call COX-3 or cyclooxygenase 3. Previously, we were talking about two types of these enzymes, the COX-1 enzyme and the COX-2 enzyme. Acetaminophen has almost negligible anti-inflammatory effects when we compare it with aspirin, or we can say that it does not have any anti-inflammatory effects. At therapeutic doses, acetaminophen has little if any effect on the cardiovascular or the respiratory system. So you can use it very easily in those patients who have any type of cardiovascular problem or who have any respiratory problems. Acetaminophen does not inhibit platelet aggregation. It does not cause occult bleeding or gastric irritation. And it does not affect the uric acid excretion. It does not have any, too many drug interactions. Of course, there are certain drug interactions, but not too many drug interactions like other NSAIDs they have. Acetaminophen is well absorbed in the small intestine after oral administration. The drug is evenly distributed throughout the body fluids and tissues, and it freely crosses the placenta. The half-life is approximately 2 to 4 hours, and the primary site of biotransformation, that is by glucuronide conjugation, is the liver. So it is being metabolized in the liver. One of its metabolite, N-acetyl P-benzoquinone imine, which is also known as NAPQI, that is hepatotoxic. Acetaminophen remains the antipyretic of choice among children and teenagers because it does not associated with the development of Reye's syndrome, which is quite possible if you give children or teenagers aspirin, that they may develop that. Well, when we look at the dosage, maximum 24-hour dose is 4000 milligram in the divided doses of 1000 milligram each. In case of alcoholics, liver cirrhosis cases and other liver diseases, it is still considered as the analgesic of choice because other NSAIDs, they definitely have serious drastic effects. But we will be administering it with the reduced dose like 300 milligram or 325 milligram. Pediatric dose is 10 to 15 milligram per kilogram every 4 to 6 hours. Don't exceed 2.6 grams in total or 5 doses in 24 hours. Well, when we look at its adverse reactions or other serious side effects, it differs in the effects and adverse reactions from rest of the NSAIDs. Its main toxicity is hepatitis due to toxic intermediate which depletes the glutathione. In case of acetaminophen toxicity, we treat with N-acetylcysteine. So it is the only analgesic which is not an opioid which has a treatment in case of toxicity available, and that is N-acetylcysteine. Thank you very much for listening, and I will be coming back with various other topics to you. So if you like these topics, please let me know, and if you like the way of these small lectures, let me know, and I will definitely making these type of small lectures.